treatment of GERD at its current moment is imperfect. We're able to reduce the causticity of the reflux state by giving acid suppressants. Common examples are proton pump inhibitors, histamine 2 receptor antagonists. There's a new group of drugs known as PCABs that actually markedly reduces the acidity, and also good old antacids, and they do work very well. These are the common drugs that are given. However, do bear in mind that they do not stop reflux. If you have had an adequate trial of therapy and you're still having symptoms, the next step is to determine whether you truly have reflux. This is achieved by getting an upper GI endoscopy, otherwise known as a gastroscopy, done. A tin tube with a camera mounted at the end of it is passed down the mouth, down the esophagus into the stomach, where what we're looking for is any evidence of esophagitis or inflammation of the esophagus. We look out for whether there's any Barrett's esophagus, and we may take biopsies if necessary. We then pass the endoscope into the stomach to look out for whether there are any lesions in the upper part of the stomach, known as the cardia, which is closely related to the esophagus. Interestingly, we've actually done a study in Singapore that's been published in a medical journal that has shown that the bulk of patients who have reflux have very mild esophagitis, known as Los Angeles grade A esophagitis, or no esophagitis at all, but they truly have reflux symptoms. What we need to do is to then determine whether these patients are NERDs. Sounds terrible, but NERD stands for non-erosive reflux disease. We do that by doing a procedure known as a pH impedance study. This is where we actually pass a very fine catheter down the nose into the esophagus, and we measure the pressures and see whether what is known as the peristalsis of movement of the esophagus is correct. We then remove this tube and we replace it with a very fine wire, which we go pass down the nose as well, and we keep it in there for a full 24 hours. It's linked to this device here, which then tracks every single episode of reflux that you have over the period, determines whether it's acidic or non-acidic, and importantly, for you as a patient, determines whether there's a link between your symptoms and reflux. And with good accuracy, we can then determine whether there is reflux that's occurring with no damage to the esophagus being seen.